Hi viewers, welcome to another episode of Health Talk with Dr. Mo, a show where we make it real, relatable, and rooted in facts. Like we always promised you that every episode is going to be a hit back to back. Today, I have an amazing guest, a very amiable doctor. He is a consultant general surgeon, a laparoscopic surgeon, and also specialized in bariatric surgery. He has 25 years of experience. Wow, that's a lot of experience if you ask me. He has a master in bariatric surgery. I know this episode is going to be an episode that is exciting for a lot of people because we're going to be deep diving into a lot of things. He's been in the UAE for 8 years now. Please, welcome with me, Professor Thomas Said. Welcome, Professor.
Welcome, Dr. Mo. Really, you are more than amazing. I'm so happy to be with you today.
Thank you so much, sir. Thank you so much. It's nice to be with you. It's a privilege to be with you. So, we're going to be talking about bariatric surgery.
Sure.
What exactly is bariatric surgery?
See, let me tell you something. Bariatric surgery is not only a surgery. It's more than surgery.
Okay.
It's a matter of lifestyle behavior. Most of the patients thought that it's a matter of surgery. No, my friend, it's not only surgery. It's something which change your life to healthy life, change your life to protect you from the disease, change your life to enjoy the way you live. So bariatric surgery is a weight loss surgery or procedure which help in weight loss with behavioral change. It's very important to clarify this.
Wow, you've nailed it on the head. It is a surgery with behavioral change. So it's not in isolation.
No.
You have to make sure that your behaviors, the lifestyle you live, also works with the surgery as well.
Let me tell you a secret, Dr.
Right.
Mo. If I feel that the patient
Yes.
is not going or is not willing to change his life to a healthy life, I will not accept him. I'm not only a surgeon. I'm a professor. So if I don't feel that the patient took the decision from his own, I need to change my life to healthy.
Oh, yes.
This is the main drive to do the procedure.
Fantastic. You've nailed it on the head. So, if you're not ready to change your lifestyle, Professor Thomas is not gonna put his life for you. So you've rightly mentioned that bariatric surgery is for obesity.
Yes.
So, can you explain between gastric bypass and sleeve gastrectomy? Which one is more efficient, and how do you decide who does what?
See, let me clarify in a simple way.
Okay.
First one, which should be very clear, is that if we have one procedure
Right.
more efficient or more powerful, we will close the other one and will not do it, and we will only document this surgery. So it's not about which is more powerful or which is more efficient.
Right.
It's about what is more suitable for this person. And this is my experience. That's why he come to me. That's why I'm doing this for more than 20 years. Every patient have his own procedure with his own tailoring procedure according to many factors. Okay. Let me summarize in a simple way. In the sleeve gastrectomy, we decrease or we restrict the size of the stomach.
Okay.
So if he eat a lot of food like junk food, he will eat a minimal amount of food, so he's going to lose weight. El bypass, we decrease the size of the stomach, we decrease the absorption of carbohydrate, of the sugar. So if he, for example, if he take 100 grams of sugar, 80% of them will not be absorbed. So again, this is very important. We don't have one procedure is powerful on the other.
Right.
No. We have what is suitable to you and what is more accommodate to the patient, this patient. That's it.
Oh, beautifully said that you tailor each procedure to the patient. So one cap does not fit everyone.
100%. Some patient I can do a sleeve and it's contraindicated to do bypass according to many factors.
Right.
I told you before, if you have diabetes, if you have a reflux, if he is a sweet eater, what is about his age, what about comorbidity?
Yeah.
Multiple factor, you know. Even I'll tell you something. My experience as a surgeon, I can say, my friend, this one will not going to work with you. This is going to work with you. This is my experience. That's my point. So please, this is my message to the patient. Please don't be affected by the media and don't be affected by fake information. okay? If you trust the surgeon, and if you go to the surgeon, trust him to the end and trust him through the whole way. It's very important, Yama.
Nail Spartan. Spartan. You said it's Spartan. So, at what point should someone consider surgery instead of dieting and exercise?
See, it's a very important question. We have a guideline, or we have equation which is named as BMI, or body mass index. According to this equation, I'm going to say this one is eligible to procedure or not eligible. Broadly speaking, if you are more than 30 kilogram overweight, the patient start to be eligible for this.
Okay.
But let me tell you something. We have a point in the obese patient. Obesity is a chronic disease.
Okay.
So no one knock my door and come to me and tell me, Dr. Tamer, I need to procedure, until truly it come from his side and he passing a years, try to lose of weight and he failed. You got the point?
Yes. So the patient must have tried several lifestyle and diet.
100%.
Still, yet the patient is not losing weight. So that is when you accept the patient.
Let me tell you something. Sometimes I told the patient, the morbidly obese patient, my friend, you are going to do the procedure, you are going to do it at a certain stage in your life. The question is how you are going to do it and when you are going to do it. For example, you are going to do it with while you are complaining from comorbidity like diabetes, like hypertension,
right?
Or you are going to do it while you are just obese without this comorbidity, because imagine I'm doing a patient 150 kilogram which is free from this comorbidity, while I'm doing the same procedure for a patient which have a diabetes, hypertension, ischemic heart, which is more difficult, which is more complication, which is the decision is more complicated.
Yes.
You understand me?
Yes.
So please, my friend, take the right decision at the right time.
Beautifully said. It couldn't have been said. Wait. How does weight loss surgery affect conditions like type 2 diabetes, hypertension, and cardiac diseases? Because in recent years, we've been seeing a lot of people have heart attacks and just slump and die. And one of the factors is that, obesity has been a culprit for many diseases, including type 2 diabetes, hypertension, and, cardiac diseases. So, how does this weight loss surgery, how does it affect these diseases? How does it affect their treatment?
Let me tell you, Mom. The point is the whole system which you said, diabetes, hypertension, obesity, ischemic heart disease, we put it under a broad name or a big name, which is metabolic disease.
Metabolic disease.
All connected together. If you want to know the secret, it's the toxin which come from the fat cell. So as long as the amount of the fat cell increase, as long as the amount of this toxin increase, which work against the insulin, which work against diabetes, which cause hypertension, and as this mass of fat decrease, all of this comorbidities start to improve. Definitely, it's more complicated like this. I'm trying just to make it in a simple way, but this is the outline which work in. Decrease the mass of the fat. That's the secret.
So the culprit is the toxins from the fat cell.
100%.
So once the fat cells are decreased, problem solved.
That's the point. Definitely, there is some mechanism which is like, especially in the diabetes, that in bypass surgery, the passage of the food from the small stomach to certain place in the intestine stimulate hormone which act as insulin. So as if I'm double the amount of insulin. But this is additional mechanism. Again, I would like to clarify that the main mechanism is to decrease the mass of the fat cell, which release toxin, harm your body.
Right. Wow. I've learned something new. In as much as I know that, yes, fats increases insulin resistance, but to saying that there's some toxins that are being released by the fat, which is a culprit.
The toxin which I speak with you about, it stands between the insulin and the gate which the insulin should work. So it doesn't allow the insulin to work. You got my peak? Yes. So if we decrease this amount of toxin, the insulin start to work good and to do its job.
Wow.
That's it.
Okay. Is there a psychological or an emotional shift that happens when the patients finish the surgery? When they come to you very big and then you slim them down, you trim them down?
But this is a very important question. And I like it. See, if you thought that, my friend, that the bariatric surgery work only on restriction or decrease the size of the stomach, so you are wrong. We work mainly about your brain. We work mainly about your adaptation. The main idea of the bariatric surgery is to force the patient for a long period of time to be adapted in a certain amount of food, little amount of food. We adapt your brain that yes, this is enough, that the small spoon which you eat or the small amount which you eat, enough for my body. So the main success for me, when the patient come to me after 1 year from the procedure, he told me, Dr. Tamer, I don't eat at all, I'm working good, I'm fine, I don't feel I'm hungry. This is the success of the procedure. So the brain and the emotional is the main secret of bariatric surgery. Yeah.
So let me put it in a very humorous place. When you try to do portion control by yourself and you're not successful with it, then you tell the brain, you find a way to tell the brain that, look, this person has to do the portion control, and you help the brain to initiate the portion control.
That's why when I start with you, I told you, if you don't feel that the patient has the main drive from the start, I don't do it.
The mind is always a very essential tool in health. Thank you for that. What are some of the unexpected health benefits your patients have reported? So you've done it for weight loss. Are there other benefits that the patients have, unexpected benefits that the patient has gotten from your practice?
Definitely. To be a human being, to enjoy your life, to wear whatever you want, to run with your kids. If you are youth or young or teens, I see this is my work for more than 20 years. You don't imagine what do you mean by a lady 18 years and she is depressed because of her weight. She wearing a black color because she cannot wear what she want. You don't imagine when she start to wear clothes colorful, small sizes like small, medium. This is the life. This is why we're born. We don't born to be obese. Yeah. You got my point?
Yes.
Enjoying the meaning of the life. This is what we are doing. It's very important, Papa. Very important.
We were born to enjoy life. So your weight shouldn't limit you.
No.
There is a solution for you. I'm loving this. Is this weight loss surgery? People look at others that go for weight loss surgery, and they say it's a lazy man's approach. What do you think about that statement?
I believe it's the smart man approach. It's not the lazy man.
Smart man.
Yeah. Let me tell you something. I say statement before and I discussed this. There is two types of fears. The healthy fear, which when I start to be afraid from something or fear from something, so I start to investigate this and I start to choose a good doctor, a good hospital, which is using the best instrument, a center of excellence. So the fear pushed me to use the best way and to do it in the best approach.
Yes.
The bad fear or the frozen fear, when this fear make me frozen in my place. Okay. Yani if a human beings face a lion, you have one of two options. Either your fear give you a rush of adrenaline and you are going to think how I'm going to escape or run or whatever, and you are going to go with your life, or you are going to be freezed in your space until he eat you. This is the same.
Flight or fear.
This is the same. Please, my friend, don't let your fears eat you in your place. It's a very simple procedure, very safe procedure. Take no time and you can go through your life in a healthy way. Wow. So don't stop in your place and don't be eaten by the lion. Please.
Wow. So you just mentioned something which made me curious. You said it's a simple procedure.
Yeah.
How long does this procedure take and what's the healing process? I know technology has gone really far. So
see, here again, we are a center of excellence of this. During the past 5 years, we did around 3,000 cases.
3,000?
With different type, bypass, sleeve, redos.
Right.
The procedure took around 20 to 30 minutes.
Really?
Yeah. We use the most advanced technology. We are specialized in this, which is very important. Again, it took around 30 minutes. The patient start to walk 1 hour after the procedure. He can go back to his work within 5 to 6 days.
Wow.
Yes.
That's a fast recovery.
Yes. So with the advancement of the technology, with the advancement of the knowledge, it becomes piece of nut. So if you compare it with the freezing in your place or the fears which you have, it's nothing.
It's nothing, really, honestly. Amazing. Can you eat normally again? I know you've mentioned that you reduce the size of the stomach. So, of course, you can't be a glutton again, even if you want to be a glutton. But are there side effects to this surgery? I know that different parts of the stomach absorb different nutrients, especially the macronutrients in our body. How does this affect the macronutrients? Do people get deficiency of these nutrients what are the side effects of the surgery?
To clarify this point, let me ask you more.
Okay.
What is the normal? Is it the normal to eat one large pizza alone?
No.
Is it the normal to eat 2 burgers alone?
No.
Is it the normal to eat 2 plates of rice alone?
No.
So my friend, this was not normal. You was abnormal.
So for them to come to you?
My friend, some people come to me, dear Dr. Tamer, I eat this shape. Yes, my friend, I'm happy for this, but this was not normal.
They keep a whole ship?
So what we do, we got you back to the normal.
Right.
We have a certain amount which is enough to you to take the nutrient which you need, and there is a certain amount which is enough to give you the energy you need, okay, which is ideal for you. This is the first point. Second point, let me tell you something. Forget about the procedure.
Okay.
If you make a diet and you close your mouth, you are doing sport, okay? Are you going to take some vitamin or not?
You will.
You will. That's
Okay.
right. So it's apart from this is totally apart from the procedure. It's about to have a supplement or vitamins which can support your body in the right way. If you're taking right food, you are going to take the right vitamins and you will be totally normal. You understand me? So, my friend, the normal is what you're going back, not what you are doing now.
So you have to take the right food.
Whatever you want to eat, you can eat. But the point in the right quantity, which is healthy for your life and keep you healthy. This is the point. We go back to healthy life.
Okay. So do you refer them to a nutritionist to help them with their diet once they finish the surgery? What's the after surgery care like?
Let me tell you something. The first one in the pre-operative preparation, I told the patient, if you are not going to follow with the nutrition after the procedure, don't do it.
Okay.
Don't do it. It's a full package, my friend. Okay. If you don't go through the strict diet, the idea of the surgery is to make the patient able to accept this diet, because usually when he don't do procedure and he go through diet, after 1 week or 2 weeks, no, I'm bored, I'm not going to continue. But the procedure forces him to continue in this diet for a long time. So because he is afraid for any complication from the procedure, because his stomach was small, because he do an effort in the procedure, so he don't want to lose this effort.
Yes, that's true.
That's true. So if you go back, how we play it, when the patient start in the first month, for example, he start to lose around 10 to 15 kilograms. So we come, yes, you change. Never happened before. In 1 month, you lose 15 kilograms. So I'm happy, I'm going to continue. In the next month, I lose more 5. I'm happy, I'm going to continue. That is how we put the patient always forward.
Wow. You've rightly mentioned the role of diet. Let's talk about exercise. Is it recommended that they go to the gym all the time? Because I see people that have done gastric bypass or whatever bariatric surgery, and they're always in the gym carrying all sorts of things, taking protein shakes. Is this advisable?
See,